Good morning, everyone. Baby sleeping. Welcome back to my channel. My name is Iyabo. On today's video, I'm going to be discussing a topic which I think most people are not aware of because I saw in a post. And that post is not even about the post. It's about the comments under the post. That post goes like this. A woman of 23 years old put her baby inside a refrigerator. Reason was the baby was not sleeping and she got tired and put the baby in the refrigerator. But the comment goes like this, that why wouldn't there nobody with her? And this woman, they must lock her. And even some even say she should be quiet. But one thing most people don't know is that she was going through some cases that I will be mentioning now that normally happen to a woman after she gives birth. And what is this case is called postpartum depression. Postpartum depression is very common, especially in the young mothers, young, newly delivered mothers. I'm talking about a woman under 20. Teenagers is very common, and even generally among women that delivers. So it's not about that she didn't do it intentionally. So what is this postpartum depression? It's a type of depression that normally happens to a woman after she gives birth. And the research have been carried out to see why this happened to women after they give birth. But the cause is still not yet known. No cause, no known cause that is can be traced to what is really causing a woman after delivery she will be having this type of depression. But there are contributing factors, a lot of things that can happen to the woman's body, that could lead her into having this depression after she gives birth. One is that sudden drops of the hormones. When a woman is pregnant, hormone progesterone and estrogen, they play a vital roles to make sure that the woman's body adjusts to pregnancy life and even support the growing baby, and a lot of things, these hormones, to help for her tissue, for her bones, for everything in her body. So these hormones increase. So as soon as she delivers, it drops suddenly. So there is the contributing factor. One of it is that when this hormone drops suddenly, it can lead to a woman having postpartum depression. And sometimes the contributing factor could be that the woman have history of depression. For a woman that have had somehow depression in the past before pregnancy could could be the reason why she can have a postpartum depression. Also, when a woman delivers, newborn baby, oh, God bless all good mothers out there. Because babies, the sleeping pattern is, no one can underestimate it. Baby don't sleep. The time the mother wants to sleep, that's when baby wakes up. So the contributing factor could be that when the woman lacks sleep, when there's no enough sleep, because definitely when a woman delivers, her sleeping pattern change. Baby make her not to be able to sleep at the right time. So this inability to sleep properly could contribute to her postpartum depression. And again, another contributing factor is that during the delivery, the woman could have passed through a traumatized delivery. You know, when women go into labor, every woman out there does not experience the same thing, the same way of delivery. Even though all of them deliver through the birth canal, it's not going to be the same. Some have trauma. Some they are going to give them tear. Some they are going to use something to bring out the baby. And during this process, you see that there's a lot of bruises, there's pain, there's trauma around the birth canal. So when the woman go through trauma during delivery, or even she have difficult delivery, because some they will push because baby size, baby takes time to come out. All of this can contribute to a woman having postpartum depression. And again, when there's lack of support, little or even no support at all, this can lead to postpartum depression. When a woman just delivered, a new mom need her body to heal. And during this process, most women, they even have older babies they need to care for. And imagine when a woman that's supposed to have rest, she's not having this adequate rest. The new baby is making that attention where she need to give new baby attention, and again older babies, even when she doesn't have other children. The newborn stress enough for her to go into depression if there's no adequate support, or if no support at all. And where does this support come from? From her partner, from the family, and the friends around. So when there's no this support, she can go into depression. This is one of the contributing factor where a woman can go into postpartum depression. Also, is the contributing factor could be age of the woman, because the research shows that the teenage pregnancy and the young women it can be a contributing factor to why she goes into postpartum depression. That's age of the woman. And again, when there is a trouble breastfeeding, when the woman delivers, it's not just about bringing out the baby. Delivery, push, and she push out the baby. And now she goes into another level of stress. Stress of the pregnancy has ended. Now she goes into breastfeeding the baby. Baby have to feed, right? We have to give the baby food. So when the woman have difficult or trouble feeding the baby, especially the first time mom, it can be so disturbing that the baby is learning, the new mom is learning, and especially when there's no breast milk, especially that first 1 week, first few weeks of delivering the baby, this could be a contributing factor. The mother having difficulty in breastfeeding the baby, and when she see her baby crying, she can't help. She gets so worried. Again, what can make her feel go into postpartum depression is when she delivers a preterm baby. Every mother, they want to have a full-term baby, a normal baby. If you ask any pregnant woman out there that is pregnant, they always want to end it well. I want to carry my baby. I want to be healthy, to see my baby, breastfeed my baby. No woman really want to have a preterm baby. When a woman have a preterm baby or a special need baby, some women, they deliver baby with some congenital abnormality or some issue on the newborn. All of this together could be a contributing factor to why a woman will go into postpartum depression. And postpartum depression also has different types. We have the one that is just mild postpartum depression. We have moderate and to severe. The mild one is what we generally call baby blues, postpartum blues, or baby blues. Baby blues is when a woman, uh, after delivery, it normally happen or occur, or the woman experience baby blues from day one that she delivers her baby up to day 4. This can start. A woman that have a baby today, within 4 days, she can start having experience of baby blues. And the research shows that out of 10 women delivers within these 4 days, 5 to 7 of them will experience baby blues. You see that the numbers are really higher in this stage of postpartum. About 10 women gather together after delivery. Within this 1 day to 4 days of having their baby, 5 to 7 of them are likely to have baby blues, which is most common postpartum depression that women go through after having their baby. And what are the signs? What are the things that a woman will see to know, or people around her will see to know that she is going through a postpartum baby blues or baby blues? So one, you see the woman start having mixed feelings. 1 minute she's happy, another minute she's sad, and she just crying. The woman will be crying without any, there's no really reasons behind the cry. She can start crying and feeling so sad, feeling like she doesn't really need the baby. She have this mixed feeling. And again, she is so irritable. Little thing irritates her. So all of this, the woman will be having, and people around need to know all the signs of postpartum depression. That is why I'm coming out to give this awareness to people that have more than new mom around them. Do not look them like wicked mother. See, she don't want to breastfeed her baby. See, she's behaving like person we no normal. I be not be baby where you get, not be baby where this woman get, now you get, now so my mama born me. Don't compare. People go through different experiences. So what you should just notice that postpartum depression, baby blues can happen to any woman. So this woman needs your support. When you see that she's irritable and the baby blues also during that process, the woman is afraid. There's anxiety. Will she be able to take care of this baby? Will she be able to breastfeed? A lot of anxiety the woman goes through. So all of this can lead into postpartum blues. And again, she feels so unhappy or for happy. You see people around her celebrating, rejoicing, but for this new mom, she's so unhappy. And again, it can lead to her not eating properly. She will lose her appetite. And when she loses her appetite, what happens next? The process of lactating, producing milk will be reduced. And again, baby will not get enough milk. So we see postpartum mom, they need adequate support. They need these people around them. When there's support, it's less to see a woman going through postpartum. And even when it happens, the woman recovers fast. So, and again, it can make her to feel, to be unable to sleep. Because if she's not happy, she's afraid, she doesn't know what to do next, she's having mixed feeling, even seeing the baby, she's irritable, she doesn't want anything, she will not be able to sleep, because definitely she knows that she delivers a newborn baby and she cannot take care of this baby. What next? She will be having difficulty in sleeping. But when there is support, when there is care, usually this postpartum baby blues goes away gradually within 2 weeks. Remember, it happens between the 1st to 4 days when the woman delivers. and with gradual identifying her new roles of being a new mom, and with the support around her, within 2 weeks, it just goes away. It just gradually, without medication, without being admitted, it goes away. But if it happens within the short time that the woman visits hospital, we advise that she will to report it to her obstetrician or to her midwife, where they will do necessary check and give unnecessary attention that she deserves. So these are the signs of postpartum blues. I've mentioned postpartum blues. I mentioned postpartum depression, and we have postpartum psychosis. These are the three signs, three different types of postpartum depression. Postpartum depression happens generally, but they now have grades. It have grades. There are different types. So the one I just finished discussing now is postpartum blues, which we know as baby blues. So in my next video, I'm going to be talking about postpartum depression, which is a little bit more severe than postpartum blues. But whichever postpartum depression a new mom have, definitely all new mom need care, need support, need this attention, because the body have gone through stress during this pregnancy. During pregnancy, the woman body go through stress, and again coming to labor, she deliver, there's stress, there's a lot of these changes in her body. So what she need is support. So family around pregnant women, partner, family, friends, all you need to do is to support this new mom and her baby. Thank you all for watching. I will see you all in my next video. My baby is saying hello, good morning to all of you from the United Arab Emirates. Kindly support our channel. Baby, support our channel. Subscribe to my channel, and always remember to put on your notification bell, because when I come up with a new video, you will be notified.